FAVMI presents Unfolding Mental Illness, hosted by Saraswati Suresh.
Hello, everyone. Welcome to our 29th episode Beyond the Mirror, Skin Conditions, and Emotional Well-being. An insightful episode of Unfolding Mental Illness, the podcast series by FAVMI, Family's Voice on Mental Illness, dedicated to creating informed, compassionate conversations around mental health and illness. FAVMI is also the Western Zone of Families Alliance on Mental Illness, FAVMI India, founded by Dr. Nirmala Srinivasan. At FAVMI, we believe that understanding health must go beyond diagnosis and labels. It must include lived experiences, emotional realities, and the everyday challenges individuals and families navigate. This episode continues to that mission by exploring a topic that is often seen as cosmetic but is deeply psychological, the connection between our skin and our mental well-being. Our skin is not just what the world sees, it reflects stress, emotions, and internal balance. Also, many people living with skin conditions also struggle silently with self-esteem, anxiety, social withdrawal, or stigma. Through this conversation, we aim to break myths, build awareness, and highlight the importance of treating both the visible condition and the invisible emotional impact. And guiding this conversation and discussion is Dr. Rajeshree A. Mayekar. She is a consultant in skin, hair, and cosmetology, director of Profession Training Academy, and a trusted expert whose work in dermatology and holistic skincare has been recognized in various platforms, including recently the Femina India. With over 30 years of clinical training and research experience, Dr. Mayekar brings a rare blend of scientific depth and empathetic care. She's also a certified international coach, a life executive coach, a behavior skills trainer, a certified yoga teacher, besides being an ex-trainer at Kaya Skin Limited. Her insights help us understand how skin health intersects with emotional well-being and why integrated care matters so much. Just as we unfold the science, psychology, and hope behind skin health, because healing is more powerful when we care for both the mind and the body together. Welcome, Dr. Rajeshree. It's a
Hi.
pleasure to have you on our show today.
Yes. Good afternoon, everybody. I'm really honored to be a part of this team, and I hope I contribute something or add something to this important topic of mental well-being and skin. So, so going further, as you are aware, there are certain skin conditions like which we commonly see: acne, psoriasis, vitiligo, hair loss, alopecia. So we see these as an external ailments which clients come to us and reach out for their concern. But are they really an external ailments? So if we go further to probe into their deep history, why these skin conditions have been triggered, then there is some connection of skin and brain and the mental well-being. So when we are doing consultations, I think as a doctor, we need to understand the complete lifestyle of the patient and not just merely treating the external ailments. As you are aware that in today's era, there are a lot of things we are doing simultaneously. So there is a chronic stress which is happening. We are handling too many things at a time. So the stress can be related to work, the family, or even looking good can be a stressful element. So balancing these external factors becomes a little difficult for every individual. Now, how the person handles these external factors makes a person to suffer some issues it may be simple as acne or simple as hair loss. But if this particular stress extends to a certain level, then the internal organs, like the immune system, our body's immune system gets affected. And then we see certain issues of skin like psoriasis, lichen planus, vitiligo, which can give a major concern to the patient. So, as I told you, what is stress? Now, every time we talk about I have stress, I'm undergoing stress, but what is actually stress? So, stress is nothing but it's our body's mechanism to handle things. So, it is a connection between our brain and our mind. Now, brain is like a big computer. It has various chips like the nervous system. So whenever there is an external factor, external trigger, the brain interprets in a different manner and it sends a response to that particular trigger. Now, whether the trigger is good or bad, it depends on that, the response. Now, if it is a trigger which is going to be a threat, then there are certain hormones which are released from the brain. And this is what we call this as a stress. And this particular hormone, which is a cortisol, induces many issues in the body. Now, sometimes this cortisol is important because we need energy to work. Now, this little bit particular stress can help you to do some work, to engage yourself into some activity, which is good. But a chronic trigger, continuous trigger, can give you a fatigue. So this is where the issues of skin conditions are seen. Now, to say,
So,
yeah,
sorry, Dr. Rajesh,
yes.
so beautifully you've explained the connection between the skin and mental health, especially with stress, etc., happening in. So, have you seen that patients, once their stress or anxiety is treated, then their skin conditions improve? Or is it that, it's the other way around? You first treat the skin and then the anxiety. How do you actually go about doing it?
Now, as I told you, there are certain minor skin conditions which are treatable, and their durations of treatment can be just 4 weeks or 6 weeks, and the skin is back to normal.
Okay.
But there are certain skin conditions like vitiligo, psoriasis, eczema, alopecia areata. They run for a longer time. That it can be for months together or years together. So this is where we need to understand why we need to go into the deep history of what has triggered into these events. Because if the duration is longer, then the treatment as well as the recovery takes longer time. So I have seen in my clinical practice that when the history is taken appropriately and understood the trigger point and help the patient to come out of that emotional imbalance, the healing is faster. The duration of treatment is less, and the symptoms and the recovery is faster.
Okay. Okay. I understand what you're saying, Dr. Rajesh. So when with these skin conditions, it affect, obviously it'll affect the person's confidence or mental well-being. If I have some, rashes in my body, I automatically would not like to, I'll keep like probably keep long sleeves or things like that and not show the world. So how do you handle, the emotional confidence to bring back, especially with visible skin conditions, which, the challenges which emotionally one faces?
So basically, when it is on the exposed area, when we talk about the exposed area, it is the face, the upper extremities. The rest of the body is covered with the clothes. So when it comes to the gender, females are more concerned about their appearance. And when it is related to something which loses the color that we call as the vitiligo, that creates a major impact on the person. When it is on the exposed area, what we tell them is first is the self-acceptance that this is there, accept it. And it's a long journey. So during the journey, you should also be happy and take the treatment so that the recovery comes a little faster. Why this is important? Because if the person is not happily taking the treatment, it's going to impact again the immune system. So the cycle continues. So one thing is that the brain sends certain hormones to induce a skin injury. Apart from that, because of the social impact, again the reverse cycle is seen. So
Okay.
what we tell them is that acceptance, which is very important, and take the treatment because there are certain skin conditions, they just cannot go with behavior therapy or psychological therapy. It needs treatment. But what we are talking about is the duration of treatment and the recovery. So simultaneously, they can use some camouflage creams to or the foundations to, cover up the white patches. But of course, there are certain skin conditions like psoriasis, which are very flaky. They're quite visible. So in that case, they need to use their clothes, a long sleeve or something to cover their extremities so that that impact doesn't affect their treatment process.
So how do you go about treating these patients basically, because their self-esteem could be going down, their vulnerability to certain, especially when, the society talks something. So the emotional challenges which is they go about, how do you actually then treat such patients?
So, first of all, I like to understand the individual. So, in what category they belong to, whether they are anxious or they are depressed, or all these matters, what people will think impacts them. So, I go into the history and understand the individual. And then later on, as I told you, self acceptance. First is the self acceptance. Secondly, is now things have happened. Now, how to correct it? Go back, take the reverse gear. So, that needs to cool and calm your internal system. So, wherein your alternative medications that comes into play, that is what we are talking about, the parasympathetic nervous system stimulation, wherein cooling, calming, simple exercises like your pranayam, which can cool the nervous system. This should be incorporated in your daily activity, yoga, meditation, that has to be a part of it. Physical exercise, some of the exercises, because they release happy hormones. So this will come to help internally. What we're talking about, the external treatment is the tablets and the creams, they're going to work externally. But internal treatment is something which needs 80% from the person himself. 20% is from the dermatologist. I always talk in this language that 80% healing button is with you. 20% is what my pen writes on this paper and what you're going to apply the creams. So that makes them little understanding that yes, we can heal our own self. So taking a positive approach towards the treatment helps a person to heal little faster.
Okay. So do all dermatologists follow the similar kind of a way of practice?
I don't think so because with practice, I have come to know that the system of just penning down the treatment doesn't work. It is always a trigger factor which has brought the person to this condition and brought the person to your clinic. So, as I told you, the stress can be anything. right from change of place, difficulty in adaptability, or loss of some near family member, or not able to cope up with the stress, or there may be some relationship issues, financial issues. So there are multifactorial concerns. So we need to understand an individual person. So that doesn't come, although the skin condition may be the same, vitiligo will be same for everybody. It presents in a same fashion for everybody, but the concerns are different internally. So what has impacted mentally needs to be understood. So that is very important while you're taking while doing the consultation. So consultation is not something like asking the duration, but going deep into their lifestyle. So that is very important. So spending some time with the client and asking the history, that gives the appropriate treatment.
Okay. That's a wonderful way of functioning, Dr. Rajeshree, and I'm sure many dermatologists will surely follow that similar system going forward. So you were mentioning about some hormones, which affects the skin due to stress and etc. So the skin and the brain develop from the same embryological layer also. That's what I've understood. So could you comment on how this affects our life later?
Yes, so basically, brain and the skin cells are developed from the same embryological layer, that is the ectoderm. So
Okay.
they are somewhere connected. Brain and skin are connected. As I told you initially, whenever there is a trigger, the brain, there's a bigger center called as the hypothalamus, which we call medically. So it releases certain hormones, and then it stimulates the pituitary gland and then the adrenal gland. So there is something called as HPA axis. So there
Okay.
is something called as local skin HPA axis also. Same thing, the cortisol, which affects the entire body. So it doesn't affect only the skin, it can affect the entire body system. That is the heart. As you know, whenever we are in some situation comes and we are frightened, what happens to us? We start sweating, our heart rate goes faster. Why? Because there is a sympathetic nervous system stimulated. Same way, the hormone which affects the different organs in the body, that is the heart or even the gut, same way it affects the skin. But as I told you, it is not just one response which causes issue. It's a chronic state. The chronic state means it may be for months together that you're going through this phase, and then it affects. So what is this hormone? The cortisol hormone. What happens? So it increases the sebum production in the skin. That is why it increases the oiliness, it clogs the pore, and that is how the patient comes with acne condition.
Okay.
It can affect the structure of the skin, that is called as the dermis, the second layer of the skin, which contains elastic fibers. So when it affects the elastic fibers, aging becomes a little earlier, faster. So that is how the skin responds to all these neuropeptides and the hormones.
Okay. And then I think it's also a vicious cycle, no?
Yes, when they develop these issues, again, the anxiety, depression sets in, and it is a vicious cycle. They go through this cycle again and again, and it's difficult to come out. It's easy to say come out of the cycle, but no. You need to train your brain to come out of this cycle. So wherein cooling, calming is simple to talk, but when you focus on your breathing, the cooling, calming happens easily.
Correct.
That's a simple way of treating yourself.
Absolutely. Another thing is, I recently came also across another child, about pulling hair and the skin ordered disease related to it. Is that also connected with some mental health issue?
Yes, so there are skin conditions, there are hair conditions. Apart from that, there are certain tics, certain habits which the patient develops with the anxiety and with depression, that they start pulling their hair at certain areas. They keep curling their hair and they start pulling the hair. So this is called as trichotillomania, wherein they pull the hair and they're not aware of what they're doing. It becomes unconsciously. Also, they may start nicking their nails. They keep, even they bite the nails. So that is also one of the condition where they are anxious. They are not able to cope up with the stress. Sometimes they develop itching at a particular zone, especially near the elbow area, knee area, which are easily accessible and to scratch. So that also happens unknowingly. They're not doing on purpose. It becomes unknowingly. And that becomes a habit. They keep on scratching at one particular zone, and that develops the eczema. So one part of this psychological impact is eczema, which we call as. And it gets triggered with stress. So whenever there is stress, they keep scratching more at that particular zone till they injure the skin. So it becomes more worsened. So here is where you need to probe and tell them that you're not doing on purpose, but you have to stop this habit of scratching that particular zone.
Okay.
Yeah.
So, and then change the entire, the methodology of distract yourself with something else or build in something.
Now, itching is something which is uncontrollable. So even if you say distract yourself, it doesn't happen. So what we do is where our treatment comes into picture, wherein simple emollients, hydrating the skin, going into self-care. So self-care awareness is very important in such type of skin conditions, wherein they need to hydrate themselves internally as well as externally. Internally means of taking plenty of oral fluids, and external hydration is applying moisturizers or oils or emollients. So that helps to prevent the itchiness, and that is how they get distracted.
Okay. And that's how you reduce the habit and mentally make them more stronger.
So we stress into repeated application of hydration. That is, put some timer in your mobile, understand when to do it 3 times, 4 times. So that keeps the hydration and reduces the itchiness of the skin.
Okay.
So that is how they don't scratch that particular zone repeatedly.
Okay. Yeah. I'll now hand it over to Dr. Sachin to take it forward, Dr. Rajeshree. Yeah.
Yes.
Over to you, Dr. Sachin.
Thank you, Saraswati. I think that's a very wonderful point made about mind and the skin, and how does mind actually impact the skin. Just to carry it forward, uh, should one thing is about how to address stigma, which you have mentioned earlier, due to leukoderma's chronic skin conditions. Uh, Also, should dermatology treatment sometimes include psychological support and therapy?
Yes. So these, as we said, vitiligo and psoriasis gives lot of lower self-esteem, and sometimes they need to form a group and understand from other patients who are suffering from the same issues like vitiligo and psoriasis. They can have a group therapy and understand how they are tackling their issues. So sometimes when they have the group therapy, they understand that, yeah, I'm not the only person who is suffering. There are people who are also suffering, and they have made an attempt to come out of this issue. So sometimes group therapy helps, and talking about themselves, not feeling low about what they're happening. So sometimes they become socially withdrawn. So it is very important to make them aware that it is nothing something to hide about it, but you have to talk about it and not to have fear about these conditions, because they most of the time we can treat these conditions if they are of less impacted areas. We can treat them completely and have some period of free of these skin lesions. So there are sometimes some therapies which can help them to be free of these issues for a certain period of time.
Thank you, doctor. What role do sleep, diet, hydration, lifestyle, and emotional health play in skin recovery? Along with mind, what is a good feasible diet for skin?
So, as we said, these are induced by stress. What we are talking about stress, but what is stress? They release free oxygen radicals. So here is where the antioxidants come into picture. So improving the food habits in terms of having rich vitamin C intake, food also, I ensure that I tell my clients that have at least 25% of your diet daily, include fruits, dry fruits, and salads into your regular intake. So that covers the entire zone of vitamin A, vitamin C, and antioxidants, where blueberries, pomegranates, these fruits help to give antioxidants, and also to drink a lot of water, which is very, again, important. Hydration is important. That helps.
Okay, and ma'am, do we keep reading in books that fasting actually helps clears toxins, which is told in naturopathy. So does that actually really help, or there should be like a particular food diet, like, because people eat veg, non-veg. So what is the thing they should follow actually in their daily lives?
So, as you know, we follow certain clock. So, body's clock is also to be respected. We can't have food throughout 24 hours. So, as we said in Ayurveda, they practice the system because they respect the body's circadian rhythm. That is very important because the body is tuned to this clock. If you are eating at wrong time where the body needs actually rest, then it disturbs the entire system. So what is important is the time when you eat food and the time when you sleep. If this is given the priority, the rest of the things falls in place. Now, most of the conditions, simple as we spoke about hair loss, and even there are certain acne conditions which are related to PCOD, menstrual irregularities. So everything is linked to each other. It is not like skin is different, acne issues are different, obesity is different, or irregular menses are different. Everything is interrelated. Now, when this gets disturbed, because the sleeping time is disturbed. So what is important is going off to sleep at right time. So what is the right time? The 10 p.m. to 2 a.m. is the sleeping time. Why the sleeping time is important? Because the brain requires little rest and it releases certain hormones which clears the toxins of the body. Now we are talking this because this is a simple therapy which does not require any cost. You just need to take a good nap at right time. This is important. Secondly, eating food, the time of eating food is also important because the early morning time is also to release the toxins. And after that, you need to provide certain healthy food in your body. So the sometimes one meal and 2 meals are important factors which play an important role in overall regulation of your body. It also helps to reduce the excess weight, what we call as obesity, and also it helps to regularize the menstrual cycles because they're interrelated.
No, no, thank you, doctor. Because we see so many conditions like PCOS, etc., which are stress-related conditions which have come up in our society. And to just go to the next question about social and cultural pressures, how does social media today and beauty culture impact people's mental health regarding their skin?
Sometimes it is good, sometimes it is not good. So, awareness in social media about taking care of the skin has really helped in awareness, because what we have seen 10 years back, the awareness was not much about skincare. Simple as that of using a moisturizer or a sunscreen and a night repair cream, or taking care of the hair, uh, not only during the issues, but as a regular healthy hair habits. So social awareness has helped many people, but having a perfect skin and flawless skin is not actually possible, because there are imperfections in every skin. So what happens in younger individual, they go for perfect skin, which is not actually the need. You need to have a healthy skin, that is more important. So having flawless skin is nothing bad, but that is not actually possible. So sometimes over treatment happens. So what is not required for the skin, they go for these perfections. So social media, sometimes awareness is good, but too much of knowledge is not also good. And in some medias, if the skin is not good, they have been criticized. That also impacts the mental health of a person. And that is not taken as a good feedback by some people. So that also impacts the individual.
Correct. No, thank you. And what are the myths about perfect skin would you like to correct? Because now uh, we have a lot of skincare chains like Kaya, and a lot of people skin a lot of people who we see in the mall have these skin shops which actually tell you how to look at your skin, what to use. So how do you decipher and say this is the perfect skin? And what are the myths we would like to bust? Because there's now so much of consumerism in the market. How do you decide what is a myth and what needs to be done for a perfect skin?
So, as we said, following a simple skin routine of cleansing your skin, hydrating your skin, and protecting your skin, this becomes a normal skin routine. So, that is very important. And that awareness is really important for everybody, because there are certain skin issues, if not taken care of, they may pop out in later life. So simple as what we said about sun exposed areas, the sunlight can induce pigmentation of the skin. It can cause wrinkles. It can cause sunspots. So that can be prevented by simple skin routine of moisturizing and using sunscreen. So that is again important. But when we are talking about the color of the skin, I would say that we Indian skin type have skin type 4. So, not to go or not to chase to get a brighter skin, because everybody cannot achieve that brightens skin shade lightening. So, what you have a skin type, if it is skin type 4, accept it. Because nowadays, people are going for certain therapies which lightens the overall skin of a color, but it is to some extent not good to take such treatments for a long time, because The moment you take the treatment, the skin of the color goes down, but when you stop, it will come back to normal. So why to chase for skin of the color? Accept what you have. It's only to have a healthy skin, which is important, and not a perfect or flawless skin, what we are talking about. So healthy skin can be maintained by simple use of a hydrating moisturizer and a protector, that is a sunscreen. And of course, when there are issues, then you go for certain lightening agents which can reduce those light spots.
No, thank you, doctor, because nowadays we see a lot of people popping pills, and I think it has also led to heart attacks. Because the kind of
Right.
pressure people have to fit into a certain mold, I think that's a big threat. And thank you for your advice, because to achieve those social goals, I think people get into a lot of therapies and treatments which actually damage the other part of their health.
Because see, what we are born with, we should naturally accept it and not chase through these things, because they are going to be back to what it is. So how long are you going to take these IV treatments or oral pills to brighten your skin? So accepting the skin of the color is what I think should be the first goal, and simple having a healthy skin. So maintaining the skin hydration, I think simple. Drink a lot of water, hydrate your skin, protect your skin.
Correct. And also, I
And
think there's
acceptance, self-acceptance. This is the
correct.
first goal.
And also, there's a pressure to look younger. Like as you become older, you feel that you should look like 20 years younger.
Yes,
So a lot
so
of
there are, that awareness can really help, because there are certain skin issues. That is, main thing is, as we age, nobody can stop us from aging. We are going to age. So our skin is going to sag. We are going to have the undefined jawlines, or our eyebrows are going to sag. We are going to have these laugh lines much going deeper. Yeah, that awareness of doing certain treatments which are non-surgical can help to lift the skin. So at a certain time age, if you do these treatments, definitely it's going to help to make you look little younger. So there are treatments, or there are certain creams which boost the collagen, which we are talking about, cortisol damaging the elastic fibers and collagen, and getting age a little faster. By using certain methods, we can definitely improve the firmness of the skin and prevent aging to some extent. That is still acceptable. So I think this trend can work out. And having awareness of looking better, yes, but how much you can go for invasive, that needs a little demarcation.
No, thank you, doctor. Uh, Doctor, what is the one simple daily habit which you mentioned earlier also about using a moisturizer uh, and a sunscreen that supports skin health and mental well-being? And especially, maybe I think I can just put it for males, because I think a lot of masculine theory comes from the fact that they don't look after their skin. That's a conditioning which comes across. So what is a daily habit which both genders, in a sense, can maintain uh, to maintain a good health? So good skin and as well as good mental well-being.
So as I told you, simple mantra is having food at right time. I think it works for both the genders. Sleeping at right time, because it works for both the genders. As you said, males are a little less aware. I think no. With the social awareness, now males are more aware, and they are into the skincare of cleansing and hydrating and protecting their skin. So they are definitely aware. And simple, your diet needs to be balanced. Now, what you take and what you put inside is very important. So, have, as I told you, 25% of your diet should include your fruits, your salads, and dry fruits. and plenty of water. So simple balancing the diet helps. Rather than popping so many pills of vitamins and taking extra protein, following your regular habits of balanced diet helps.
Absolutely. And I think we have seen a change in a diet because we did not have maybe 20 years back a McDonald's. Now you have ultra processed foods everywhere. So I think we would maybe there could be a vada pav 20 years back, but now you have all the kind of joints which offer you all the kind of processed foods across wherever we go. Yes.
So sugary diets definitely affects the entire system. So I think zero sugars and no processed foods. That also needs to be added.
Thank you, Doctor. Doctor, what is the message? So based on what Saraswati spoke about the entire stress, the skin cycle, and you mentioned how cortisol affects. What is one message you would like to give with respect to skin conditions and also mental health? Because we also want to, it's a bidirectional mechanism where skin conditions affect the mind and mind also affects the skin. What is the one message you would like to give to our audience to look after their skin as well as mental health?
So as you know, skin is a reflection, internal reflection. It is a mirror. So I think the internal peace, your internal environment should be looked after. What is your internal environment is the peace within. So how do you work for that peace within is give some time for yourself. In terms of healing, healing within is more important. And that comes through simple alternative type of medications or alternative type of practices, that is pranayam, yoga, meditation, focusing on certain objects, that gives you a peace of mind. So if you have an internal peace, that is reflected outside. Apart from what we have discussed, change in the lifestyle, diet, food, hydration, following a proper skin routine. But I think following a simple and consistent time of eating on time and sleeping on time and maintaining hydration. I think I'll just put it together to have a beautiful skin.
Thank you, Doctor. Thank you very much. I think that was a very good session. It's very simple, but I think doing the basics is also very, very difficult sometimes to look after your skin as well as your mental health. And I wanted to thank you from my side and from Saraswati's side, and also for Saraswati to think of such a good topic, which affects which is so universal. But I think it's so also difficult to maintain and follow up and keep track of. So thank you very much for your time.
Thank you. Thank you very much.
Thank you so much. Thank you.